establish a baseline for the patient and certain complications that could happen. It could be like broken equipment, not clean equipment, and going by the numbers and not actually looking at your patient. So, the physician has ordered for me to take the vital signs, and for this procedure you would need gloves, hand sanitizer, a watch with a second hand, a stethoscope, pulse oximeter, and a blood pressure cuff. You will knock on the door before coming in and introduce yourself to the patient. Hi, Mrs. Dorothy.
Hi, how are you?
I'm Kseniya. I'm going to be your RT for today, taking your vitals.
Okay.
Could you please confirm your identity for me?
Darlene Lucid, date of birth, 0 blah blah blah.
Okay. And I'm looking at her wristband to make sure it is that way. And while I'm doing this, and while I'm confirming her identity, I'm going to be applying 3 or more milliliters of hand sanitizer on my hands, making sure that it's all rubbed all over. And as soon as it dries, I'm putting on gloves. Okay. Darlene, do you understand what I'm going to be doing today?
Yes, I heard about it. You doing vitals, right?
Yes.
Okay.
Okay. Do you have any questions?
No, I don't have any question.
Okay. So first, I'll be taking your pulse using her radial artery, making sure not to use my thumb because the thumb has its own pulse, and making sure I do it for a whole minute because it's more accurate. Okay. Okay, good. Your pulse is 82, which is good because the normal values for pulse is 60 to 100 beats per minute. And next, I'll be doing your respiratory rates. For the purpose of this video, I'm saying that I'm doing them, but in real life, you would not tell the patient because the patient could alter them. So I'm also going to be checking her respiratory rate for a full minute. Okay, Darlene, your respiratory rates are 16, which is good because normal respiratory rate is 12 to 20 breaths per minute. And next, I'll be taking your sats using a pulse oximeter, which would be placed on her finger. Okay. Her sats are 98, which is good because normal values are from 95 to 100%. And it says her pulse is 83, which is about the same as when I took her pulse. Next will be her blood pressure using a blood pressure cuff. Just going to put this one on your arm. over 82, which is good because normal values are between 120 over 80.
Let me know the normal patient, right?
Yes, you are healthy. Okay. Next, we'll be taking her temperature, but for the purpose of this exercise, we don't have a thermometer, so from the nurse, we got the information, and her temp is 98, which we took orally, and that's normal because normal values would be 97 to 99.5 degrees Fahrenheit. And validating her vital signs, I would be looking at the patient, making sure that the vital signs are shown on her. The vital signs are all normal, and the patient looks normal and healthy, so that should be correct. Okay, Miss Dorleen, your vital signs are finished. Are you in any pain?
No.
No? Okay, so her vital signs are all normal. She's normal and healthy, no pain. Possible causes for abnormal ranges could be a fever, low oxygen, hypertension, tachycardia, bradycardia, and things like that. And now I'm going to be decontaminating my hands, throwing away my gloves, and again putting on hand sanitizer. Okay, Darlene, I'm done for today, and I'll be back in an hour to take your vital signs again. But for now, you're doing fine and perfect. And then I would leave, and in her chart, I would record the data I took, all of her vital signs, any complaints she had, or anything I recorded or heard, I would record, and then I would go report to the physician and tell him that the vital signs are normal and the patient is doing okay, and that would be it.